Good afternoon. Welcome once again. As is usual, we'll start day 158 by asking Dr. Fitzgerald to present an update on COVID statistics.
Thank you, Minister. Good afternoon, everyone. Thank you for joining us today. I'll begin with an update on COVID-19 in our province. Since the media advisory yesterday, we have no new cases to report, and the total number remains at 268. That's 247 cases in Eastern, 11 in Central, 4 in Western, and 6 in Labrador-Grenfell Health region. 52% of cases are female, and 48% are male. And there are 23 people under the age of 20, 43 between 20 and 39, 39 between 40 and 49, 59 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 263 people have now recovered, and in total we have tested 27,668 people. While we have all been affected by this virus, perhaps none more so than our children and youth. Since March, they have experienced swift changes in all of their activities and daily routines, and all families have done their best to adapt to this ever-changing environment we find ourselves in. As families begin preparing for the coming school year and children get excited about seeing their friends and teachers, top of mind will be thinking about what the new normal looks like for them. Managing this pandemic has always been about weighing potential risks and harms against the benefits of our actions. And right now in our province, we must consider that the harms posed to children by an ongoing absence from school is outweighing the harms presented by COVID-19. In these unprecedented times, our school communities can provide a source of normalcy for our children and youth. And while there will be changes in the learning environments to ensure everyone's health and safety, what will be the same will be the familiar faces to greet them and supports to help them readjust to school settings. As a new school year brings excitements of seeing old friends and making new ones, but it can come with feelings of anxiety and uncertainty. Open communication between parents and children is important. Ask your child what is on their mind and problem solve together. As we all continue to adjust to the new normal over the next month, take opportunities as they arise to model good behaviors and public health practices for your children. For example, teaching and showing your child how and when to wash their hands, how to put on, wear, and safely remove a non-medical mask, what 2 meters looks like for physical distancing, good cough and sneeze etiquette, and when to use hand sanitizer when soap and water aren't available. Modeling these behaviors for your kids inside and outside the home will help both you and them in preparing for back to school. I want to remind everyone that with any change, it is normal if you or your child are experiencing feelings of anxiety. I would encourage you to visit Bridge the Gap at bridgethegap.ca to access a wide range of locally available, confidential, and free mental health and addictions programs for people of all ages. As I've said before, COVID-19 is with us for the foreseeable future, and our public health measures play an important role in preventing the spread of the virus. Please continue to stay at home when you are unwell, cover coughs and sneezes, practice good hand hygiene, maintain a safe physical distance of 2 arms lengths from others while in the workplace or public spaces, and wear a non-medical mask when that is not possible. These protective measures will continue to be our best defense against this virus. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory, and our total number remains at 268. Our school communities play an important role in the healthy development of our children and youth. Our learning environments, our educators, our administrators, and others who support the wider school community all help in shaping the lives of our children and youth. We will continue to navigate living with this virus together. Thank you.
Thank you very much, Dr. Fitzgerald. For the benefit of our viewers, our Premier Designate, Dr. Fury, is still engaged in the transition process and currently being briefed on a whole variety of portfolios. Before I begin with my remarks today, I'd just like to take a couple of moments out to mention a couple of sad events. The first is the passing of Dr. Walter Reynolds in Alberta, He was a family man, a family physician, working in a walking clinic when he was attacked while working and died as a result of his injuries. It is unfortunately a risk that our healthcare workers and physicians from time to time have to face. Our thoughts go out to his family and his colleagues in Alberta at this particular time, and I send them our condolences from the Department of Health. The second is the passing of a lovely young lady, Olivia Reardon, a young lady with a very rare mitochondrial disease who was a student at Immaculate Conception School in Colliers. And I know the community are planning a celebration with COVID in mind to celebrate her life. And again, our condolences go out to her family and that community. Again, we have no new cases in Newfoundland and Labrador, a testament to how seriously, even now, people are still taking the virus. And that's important because it is a challenge to fight pandemic fatigue at this stage. We've been at this in the province publicly since early to mid-March, although the Department and Public Health had been working behind the scenes well in advance of that. One of the questions I've been getting quite frequently now as services are ramped back up to pretty well normal in a large portion of the regional health authorities is around how patients from the community actually get to a specialist or in for a procedure. And I think it would be worthwhile just explaining that process so that people have a better understanding of the steps involved and the nature of the process. This is a clinical process, and what happens is an individual would go to their primary care provider, a nurse practitioner or emergency or their family practitioner with an issue. That healthcare provider would feel a specialist appointment or a consultation would be appropriate. And to organize that information clinically about the individual is then forwarded to a specialist of choice, or in situations where there is a pooled admission procedure to the appropriate email or fax number. That referral information, which now for quite a large area of healthcare or an increasing area of healthcare is done electronically, consists of what is deemed pertinent information for the specialist to look at. And that specialist will then look at that information and put a ranking on it in terms of priority. And it can be 1, 2, or 3, or A, B, and C. That patient's referral is then passed to clerical staff to action. And the speed with which they get their appointment depends on the urgency ranking that the specialist has given that information. And then the specialist office will contact the individual concerned, either directly or in the case of some practices in St. John's, back through the family practitioner. Then the appointments are arranged and further tests can be organized or indeed definitive treatment. And at that point, a specialist or a family practitioner may refer someone for a diagnostic test. A similar process happens in that information is then sent to, for example, the diagnostic imaging department. And a radiologist, a specialist in that field, will look at that and prioritize the request on the basis of the information that's provided. And an appointment will then be sent out. One of the challenges I've had particularly is addressing concerns of people who at the beginning of COVID were in that process somewhere and have not yet heard back or had heard and then were rescheduled. And I have tried my best to explain that these appointments would be rebooked. But the important feature is that those appointments are prioritized on the information that the specialist or the radiologist or diagnostic physician has available to them when that information was sent in. And if that information has changed and the patient's condition has changed, That then needs a dialogue to refresh that information so the specialist is fully up to date. And that's why this is still a clinical process. The individual, the patient, will go back to their primary care provider, and that information would then be relayed electronically or by phone call sometimes to the specialist, and priorities reassigned if need be. This is a totally clinical process. There's no interference from administration or from the Department of Health. And it is determined by clinicians on behalf of their patients as advocates in the case of the referrer and on behalf of the specialist providing that service. So I hope in some ways that provides a little bit of clarity. The dialogue needs to be repeated over the passage of time. People who are in a lower priority, their condition may change, and that should be a trigger to discuss that so that your priority can be reassessed. But that ability to reassess is only as good as the information that is provided to that physician. So I hope again that will shed a little bit of light on that for those people who feel that they may have been overlooked in some way. If they're concerned, their first port of call should be the last physician they spoke to or their referring physician who can help navigate that system. From the point of view of public health, we still need to continue, particularly with the warm weather, to observe Dr. Fitzgerald's recommendations about people, space, time, and place. That's your checklist to determine the level of risk you are exposing yourself or your family to. So if it's a lot of people in a small space for a long period of time, you might want to think about how necessary that is, because physical distancing is still the key to reducing the transmission of COVID-19. And in the absence of an ability to physically distance, social masks, non-medical masks, are known to provide extra benefit for those around you. You wear your mask for others. So 6 feet and masks if you can't. And I think with that, I'll conclude my remarks and hand it over to Kathy for questions in the media. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you, Kathy. Either the Minister or Dr. Fitzgerald can answer this. The Tories have been calling for more testing to be done on arrival. We know that the August 7th case was caught through a private lab. They were asymptomatic. Otherwise, if they hadn't expressed symptoms, wouldn't have been tested. Is the province now looking to increase testing, even though it is a point-of-time test?
So certainly testing is something that we're always looking at, really, as to how do we use our testing most efficiently. So these types of questions we're always considering, but to use one case to make a decision is not necessarily the best way forward. So we're looking at all the evidence, and we will, we'll alter, as we've always said, if there's new evidence that comes out that says that we should do things a different way than what we've been doing, then we'll certainly consider that.
I think the key piece there, Kellyanne, is the fact that this individual left the airport to go into 14 days of isolation. That is the real true screening test for COVID-19. That has worked in other jurisdictions where they have had false negative tests in the past. And indeed, if you look internationally at those jurisdictions that do have a firm 14-day isolation policy, their figures are by and large much lower in terms of incidence of cases than those other jurisdictions.
Thank you. And Walmart Canada has made masks mandatory for customers and staff throughout the nation beginning today. should Newfoundlanders and Labradorians become used to the idea of wearing masks more often, especially in some of these larger department stores?
Certainly, as we've always said, anytime that you can't physically distance, you should, we recommend that you wear a non-medical mask. So I would always recommend that you have one on you that you can put on in times when you may not be able to keep that physical distancing recommendation. You know, as our epidemiology changes and as things change with regard to you know, other public health measures, they may change as time goes on, then masking is certainly something that we'll be continually considering.
Thank you. This question you probably were fitting for last Wednesday with it having been what would have been Regatta Day, but rowing has not been cleared for a sport to be conducted that's with 6 people or 7 people in a boat, but yet rugby and basketball and those sports can happen. I'm just, I guess, looking for the clarification on why this may be, considering a rowing team is a team that won't interact with another team.
So I think there's ways that things can be done safely, and that's certainly what these sporting organizations have been advised to do. And the same goes, you know, there are things that rowers can do without actually rowing 6 to a boat. So I think, you know, every sport is different and it has to be adjusted according to how to play safely.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi there. I have a question about masks. Will students and teachers in Newfoundland and Labrador be required to wear masks in September in school?
So that's a question that we're still debating right now, and we hope to have some definitive recommendations on that in the coming days.
We've provided advice to the school board and the Department of Education. Indeed, I had a very good meeting with both of those parties just this lunchtime. Their plan will be unveiled in the next few days, I gather. We have done our best to provide healthcare support. At the end of the day, this is their plan, and they, through the school district, will be operationalizing that. So I think watch this space. The board will be having some announcement in the coming days.
There's a cinema owner in Grand Falls, Windsor, who's saying that his business is being held to a different standard than businesses such as restaurants. He's limited to having 50 people or 50% capacity in his cinema, whichever is smaller, while restaurants can have 50% capacity, which could be higher than 50 people. Why the different approach depending on different businesses?
So there's a couple of things to keep in mind. You know, people, space, time, place, right? So there's people who are watching a movie generally tend to go in together. They spend a period of time together in the same enclosed space. So that's a little bit different than people who are going to a restaurant who may overlap and may not spend a whole lot of time with each other. But certainly these are questions that we are looking at presently, and you know, gathering size is something we're reevaluating as well. So we may have some more information in the coming days.
And actually, on that exact topic, does the province have any intention to change the limit, the current limit of 50 people at gatherings? And if so, what direction are you going in, and when could we see those changes?
So as I said, we are discussing that right now, and in the next few days, we hope to have some further information about it.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I'd like to follow up on the masks in the school situation. There's a very viral video going around of a woman demonstrating why a younger kid cannot wear a mask, because it's just every reason under the sun will come up for them to take it off. But if masks are primarily meant to protect others, how is a teacher protected from students by wearing a mask?
So was the question, how is a teacher protected?
How is a teacher protected from 50 or 100 students by wearing a mask if those students are not wearing masks?
So the question with regard to teachers is, I don't know that we've made any recommendation with regard to teachers wearing a mask. The question often comes up, like for teachers who are going from one group of students to another. So if you have a situation where students may be in a cohort, if you have teachers who are going from one cohort to another, it's to protect the cohort so that the person is not, moving from, potentially spreading from one cohort to another. We've always said that masks are, the main function of a non-medical mask is to protect others.
Yep. Okay. And further on the school year, we're all aware that coughs and colds usually brings an onslaught of that. And are there any extra protocols or plans being made to ramp up testing in an effort to catch COVID-19 clusters?
So certainly with our testing protocols, if we have a case, all the people who are around that who are close contacts will be tested. And those are things that are being developed right now as we speak as to what the protocols will be in place in schools in particular.
Okay. And also for schools, assuming you do have a cluster, are there plans in the works to possibly shut down schools again if it spreads?
So, our goal is to not have to go back to a lockdown, right? I don't think that's any secret. We've said that from the start. And our goal is to continue to move forward and to be able to manage cases and clusters as they occur. So it's very difficult to make a blanket statement about that because it'll be very localized in its context. And, we'll have to take into account the local situation, the situation of the school, the situation in the community. And we may see a situation where we have an outbreak in some kind of facility or workplace or whatever the case, where there may be 20 or 30 cases, but if it's well contained within that within that facility or in that outbreak, that may not result in us needing to consider closing down a school. But then if you have fewer cases in a community, if you have, and we can't find the source of those cases, then that's a little more worrisome. So it's very difficult to give a hard and fast rule and to say a specific number. It's very much about considering the whole context of the cases and the outbreaks and the community and the school itself. So that'll have to be done on a case-by-case basis, I guess, for want of a better term, and it'll certainly be done in conjunction with the public health authorities and the regional health authorities.
Thank you.
Our next questions are from Victoria Badcock of VOCM News. Please go ahead.
Hi there. We've heard from a man who was on the Air Canada flight AC690 from Toronto to St. John's on August 6th. He was not contacted about the positive test. He noticed it on a news article, the update about that. He is wondering why he wasn't contacted personally and what is the screening process there?
So I can't speak to the specifics of that, but certainly the risk in and of itself with this flight was quite low, as the person was wearing a mask the whole time, and had no symptoms whatsoever. So, the risk was low. That was, the media release was done out of an abundance of caution, if anyone did develop symptoms, to get checked.
The interesting thing there, unfortunately, is even now, it is difficult sometimes to identify everyone who was on a flight. The provincial government, the Department of Health, have had very limited success in accessing aircraft manifests for passenger details. And this has been a persistent complaint of most jurisdictions that I have had dealings with during the health ministers' meetings. That's why, if there is any doubt in public health's mind that everybody who was in proximity to an index case has been identified, that's why we issue the travel advisory. That's our safety net, our catch-all, and obviously in this situation it worked.
And Minister Haggie, what kind of conversations have you or the department had with the folks at Pope Productions?
The Pope Productions contacted Public Health with their plan, and there was a dialogue there. I actually spoke with Mr. Pope on a couple of occasions about his plan. It had received public health blessing, and I was suggesting that this actually could be a template for other movie businesses in other jurisdictions who would want to work during COVID. Those were the kind of discussions I personally had. I'm sure that public health had much more granular discussions about their specific isolation requirements and such.
And then on the topic of back to school, of course, the school board is saying they need more advice. What is the school board looking for exactly?
I don't know that I can speak for the school board, but I can say that public health has provided advice. We have, as always, and as I've always said, our job is to provide guidance, but we're not able to operationalize all of that in areas that certainly are not our area of expertise. So we have certainly been in conversations with the Department of Education and Early Childhood Development as well as the school districts.
We in health and public health are not educators. We are not in a position to say how our guidelines or our recommendations would actually impact a specific classroom setting or in a specific facility. That job falls to the educators between the Department of Education and the school board. And in actual fact may differ from one school to another. I mean, a small school in a very rural community will have different challenges implementing those recommendations, perhaps, than, say, one of the larger facilities in metro or in one of the more urban centers. So that's why we can only provide context and advice. The detail of the plan has to come from the department concerned, and the operational elements would come from the educators who are on the ground. So it's probably a good question to ask education.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thanks. Why isn't this province allowing seasonal residents who, for example, own property here, they have the ability to isolate, why aren't they able to come in from other parts of the country? I've heard, for example, from people who own homes and winter in Ontario, for example, and they've been told they're not allowed in. What risk do they really pose if they have a plan and are able to isolate?
So we know that our risk is with importation, and we know that people can be infected and not have symptoms. And we know that people are not always, 100% strict with their self-isolation. So we do certainly, in other areas, have experienced outbreaks as a result of that sort of thing. So, we are making decisions based on the epidemiology elsewhere, as well as our epidemiology, and then also our public health and health system capacity.
Looking across the country, though, every other province is allowing seasonal residents, even places like PEI in New Brunswick, which had put in restrictions early on. They've eased them and allowed some sort of exemption process. So why are we lagging so far behind those other provinces when it comes to opening up to seasonal residents?
I think the answer is the same. We've taken into account our situation and our contextual factors to make that decision. So I can't comment on it in relation to what another jurisdiction is doing.
In the U.S., schools, some schools have opened, and we've seen places where they've then had to immediately shut after large outbreaks. What's stopping that from happening when schools open in Newfoundland and Labrador next month?
So outbreaks can happen at any time, and we have to remember that, and that's why we say that it is important to maintain those good public health measures while you're out and doing your daily activities and things like that. We hope that we have put, certainly, when it comes to schools, that there are safeguards that will be put in place. One of the most important things we can do to reduce the risk of outbreaks in any facility, including schools, is to screen people for symptoms of illness before they enter and to stay home if you're unwell, including students and staff. So that's a very important thing that we will be doing, as well as, hand hygiene, increasing the amounts of hand hygiene, looking at keeping children in smaller groups, all of these things that that education departments are looking at and educators are looking at to reduce the risk of spread in schools. I think we're taking it very seriously here in Canada and in Newfoundland and Labrador. So, there is a difference to the, I'll say, the local thoughts and milieu and political environment that I think changes the situation significantly here in Newfoundland and Labrador and in Canada.
Peter, I think a safe school or a school at low risk of getting COVID in its students stems from the behavior of the community in which that school is situated. And I think in those areas where you see very low prevalence in the community because they have listened, as most Newfoundlanders and Labradorians have, to the guidance from public health. In those areas where the prevalence is very low, the schools are doing well. It's in those areas where there is perhaps a slightly different attitude about the virus and distancing and masks and those kind of things that you see those states in the US troubled by significant school outbreaks. So a safe school is a result of a conscientious community.
Thank you.
We have some time left for more questions, so I'm going to open it up to 2 more questions per reporter, starting with Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm sure this will be addressed in the operational plan, but from a public health perspective, with rotational workers and their children, how is that going to work for going back to school if they're self-isolating when these children would be in school?
Rotational workers are the ones who are required to self-isolate, and Dr. Fitzgerald's team have recommended some relaxation in those. The rest of the household, assuming no symptoms in anyone, is not, and therefore children of rotational workers would be no different than, say, the spouse of a rotational worker who worked in a hospital, and there are a lot of those in my district. So they should not present any risk to themselves or any other children.
Thank you. And I know it's still about a month and a half, 2 months away here, but in looking at it, and I don't want to be the party pooper, but when we look at Halloween, is that something that just isn't practical to happen this year with COVID-19?
I hadn't thought of Halloween. What about you, Dr. Fitzgerald?
Oh my gosh, guys, I'm still trying to think about school. Halloween, I think if we get back to trick-or-treating, I think that can be done safely. I'm certainly, things would have to be different, significantly different than where they are now, I think, for us to cancel Halloween. But, there are, if we're talking about adult celebration of Halloween and parties and things like that, well, I think we've already put parameters in place for how that can be done safely. So, again, we're a long way out from that in COVID time. So I would stand to be corrected at some point in the future.
Sorry, just think about all the candy. Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hearings into the constitutionality of the travel ban ended today. If the Supreme Court of Newfoundland and Labrador does invalidate the measures that are in place right now, has planning begun for a plan B, and what does that plan entail?
From our point of view, we're pretty confident in the position that we presented. It is before the court. The decision will be made by Justice Burridge. And whatever that decision is, we will go through it very carefully and see what implications that has for the department and for the legislation.
And just one more about masks in school. Earlier in the press conference, Dr. Fitzgerald, you said that, it's the recommendation of public health that at any time you're in a situation where you can't social distance, you would have a mask. So, is there any difference between a school setting and a store setting or somewhere else where that would be expected?
So I think we have to consider that school is, there's everything we do is a weighing of risk and benefit, right? So schools are, we can cohort children into groups, and we can ensure that those groups are, stay within themselves and have most of their activities together, and can distance from other groups. It's not, there's no system that's perfect, but we have to look at the harms that are that children are experiencing by not being in school, and we do have to consider that and look at what's the greater harm at this point. Is it not being in school, or is it COVID? And I think most people would agree at this point that not being in school certainly is the greater harm.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi, I wanted to touch on the travel ban. I realize it's now in the hands of the judge, this particular case, but the obvious question is not so much preventing people from bringing the virus in as it is the rationale for letting some and not others. And I'm wondering, for example, do family events such as weddings or reunions, do they, as a rule, qualify for a travel exemption?
So immediate family members involved in weddings certainly have been exempted to come in. Family reunions, to the best of my knowledge, are not exemptions. So it's generally things that are considered more essential. It's working, if someone's coming for work, exceptional circumstances around caregiving or bereavement and end of life, that sort of thing.
Okay. And there's one other thing I've been given to understand, that blood work now can take a week or more to get done through appointment, and that might even happen when you have a relatively important follow-up blood work. Is there any consideration being given to expanding blood collection somehow to counteract those delays?
We're doing a couple of things with blood collection. One, again, it's prioritized on the basis of the information the requesting practitioner puts on the form. So urgent blood work has always been done. We have introduced through Eastern Health at Majors Path an appointment system whereby people can go online and schedule an appointment to suit. That is currently being evaluated. It's something of a pilot, and I think if it shows the benefits that it may well have, that process can then be speeded up. I think we acknowledge that there are certain areas of the RHA that are always going to be a bit slower as a result of COVID because of the practices through infection prevention and control and the like. So that's a very good question, and it's one of the things that the RHAs are reporting to me on a regular basis about is the delays around blood work and the return to normal and the backlog. So it's active. Are we there yet? Probably not, but we're keeping an eye on it and see what we need to do.
Thank you.
Our next questions are from Victoria Babcock of VOCM News. Please go ahead.
These are more questions that I could probably pose to the education department, but I'm just going to ask anyway because parents are starting to get a little bit impatient. As in terms of buses, 72 kids can usually ride on a bus. What will be the protocol there? Any idea?
I think that is a very good question, and it will be on a lot of parents' minds. It's a regular question in the House of Assembly when that opens, even in November, about busing. The short answer is the school board will be the ones to answer that. We hear the concerns. The chair of the school board today said that the important thing with this reopening, their reopening plan was to get it right. And that, I gather, is really their focus at the moment.
And I'll stop asking you questions about back to school now. I'll ask for an update on the COVID-19 app.
That is nearly baked, as they say. We may have an announcement about that in the very near future.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. Dr. Fitzgerald, you mentioned in the discussions about why seasonal residents, for example, still aren't allowed in, that some people aren't quarantining. How often, or what sort of numbers do we have on how many people are breaking their quarantine?
Well, that's a very difficult number to get, right? Because we often don't know about it. But you know, with quarantine, we are relying on people to be honest about it if they are or aren't. Even when we have our follow-up, you know, it's still a phone call. So, but there are studies that have shown there are significant percentages of people who don't follow through with all aspects of their quarantine. Now, that's not to say that everybody is just saying, you know, I'm going out, it doesn't matter. But, you know, quarantine is fairly strict, so there are significant numbers of people who aren't adhering to all of the guidelines of quarantine. I can't speak specifically to what the percentages are, but they are significant, just because I can't recall it now from the study. But
if the concern, though, is about people not adhering to those rules, why don't we do like what other jurisdictions will do, for example, and have people randomly come and knock on the door of where people are supposed to be isolating in order to make sure that they're actually there?
I think one of our challenges, Peter, is that whilst everybody calls us Canada's newest province, we are in actual fact the oldest territory. And I think that realistically is a challenge. When you look at the number of communities we have and the population density we have, that is an enormous challenge. At the moment, we are relying on, where possible, landlines and telephone calls. And I think, you know, something's working because our prevalence at the moment of COVID is extremely low. We have 2 active cases. It's no excuse for complacency. But I think it's another piece of how well Newfoundlanders and Labradorians have done. So that's not to excuse people who choose to feel the rules might not apply to them, or someone who might forget and slip. But it is a fact of the case at the moment that has really fallen on the individuals and an honour system, and we do what we can with the resources we have using telephones.
Before we turn this back to Minister Haggie for some closing remarks, I'm going to go through the list again and see if Kellyanne Roberts has any further questions.
When it comes to the tested numbers, does that include the private companies, for example, the one that Pope Productions is going through?
yes, it does.
Thank you.
Kathy Butler?
Yeah, I would just like to get a little clarity on that. Is there any plan to do with the Canadian bubble? Is there any update on that, loosening border restrictions for the rest of Canada?
No.
Peter Jackson?
Yeah, I just wondering if for someone who's paying taxes on a property here that they are not permitted to go to, has any consideration been given to some sort of a rebate?
I wouldn't be able to answer that, Peter. That's an issue for a municipality as much as anything else, so I wouldn't be able to shed any light on that.
Thank you.
Victoria Babcock?
Hi there. Will the Education Minister be available at next week's update?
I would suggest you go through the usual channels and ask that question of the Department of Education. We have, as far as I know, my colleagues have been around and available, and I can think of several who've done media. In actual fact, Minister of Education sat at this panel during the COVID issue, so I'd have to direct you to Education.
Perfect. Thank you.
And our final question from Peter Cowan of CBC News. Please go ahead.
A question about the new case from last week. The news release said that she was asymptomatic. Just wondering, Was she in fact pre-symptomatic, or are we having our first case where in fact someone is exhibiting no symptoms of COVID-19 even though they are infectious?
So to the best of my knowledge, that person remains asymptomatic, but that's not the first person. We've had asymptomatic people before.
Okay, thank you.
Back to you, Minister Haggie.
Thank you very much, Kathy. I just wanted to take this opportunity. I mean, we've sat here for 158 plus days through times of great uncertainty, and we've navigated our way and still continue to navigate our way through COVID. But I think in case I don't ever get a chance again, I would just like to highlight the role that the people on the other end of the microphones have played over the course of the last 5 months. The members of the press, some of whom have been here from the get-go and may not yet have had a holiday, have played a crucial role in what I think we have done very well as a government and as a collaborative with the media. We have acted, and they have acted, as a great source of reliable, trustworthy information in a time of great uncertainty. And I would really like to just take this opportunity to thank all of them who sat through these hour-long briefings. They've asked respectful questions. Some of them have not been easy. They've been forceful, but at no stage has any of the media really done anything but an excellent job. And so I'd just like to round out this week's briefing with a very clear thank you from the Department of Health, certainly, and myself, for the role that the mainstream media have played in managing COVID-19. And I think the people of Newfoundland and Labrador have been very well served. Thank you.